Good morning. We present Successful Extracorporeal Organ Support or ECOS Therapy in COVID-19 Pneumonia, a Case Report. Authors: CYNTHIA ESTEFANÍA VILLASANA SALAZAR, CYNTHIA ISABEL ORTIZ LÓPEZ, LILIA MARÍA RIZO TOPETE y JORGE ALBERTO HERNÁNDEZ Portales. Patients with severe COVID-19 pneumonia can develop acute respiratory distress syndrome, which triggers respiratory failure. Extracorporeal organ support therapies, like extracorporeal membrane oxygenation, continuous renal replacement therapy, or plasmapheresis, can be used as part of an integral management in patients with refractory hypoxemia, even with the appropriate use of optimal mechanical ventilation and pharmacological measures. We describe a case of a 31-year-old man with a history of morbid obesity, admitted for respiratory failure due to COVID-19 pneumonia. As we can see on Figure 1, his CT was classified as CORADS 5. Upon admission, he is managed with mechanical ventilation due to his Kirby index in 52. He continued with little improvement and hypoxemia, so it was decided to start ECMO therapy within the first 12 hours after the start of mechanical ventilation. Subsequently, management with CRRT with Prismaflex and Oxiris filter is initiated in the second day of hospitalization. 1 day later, a scheme of 5 sessions of plasmapheresis was started as an adjuvant therapy to reduce the inflammatory load. The patient presents a rapid clinical improvement and a significant decrease in the inflammatory markers. As we can see on Table 1, with interleukin-6 levels from 505 to 177. It then was decided to withdraw ECMO and CRRT on the 4th day of admission, and then mechanical ventilation 24 hours later. The patient was discharged with no complications 10 days later. The clinical deterioration of patients with COVID-19 is believed to be a result of an inflammatory state caused by a cytokine storm. CRRT with Oxiris filter has been associated with a significant reduction in cytokine and endotoxin levels thanks to its extracorporeal purification capacity. It is being used for hemofiltration due to the high capacity to absorb endotoxins and cytosines. On the other hand, plasmapheresis treatment also eliminates inflammatory mediators by replacing the plasma containing these molecules. Management with ECMO has shown benefits as a salvage therapy in patients with severe hypoxemia despite the use of mechanical ventilation. The success of these treatments depends largely on the early onset of ECOS in the critical ill patient. Starting them in the most opportune time, as we did in our case, it is key to the patient's clinical improvement. Thank you.